scooting right along. Did you like that intro? Yeah? No? Okay. Muscle terminology. What I want you guys to know is that a muscle action is going to be the specific movement of a joint. It's usually going to be resulting from a concentric contraction. So that is a shortening contraction across the joint of which a muscle is. So if you think about the bicep, as the bicep crosses into the radius and the ulna, or into the forearm, if you will, you can see that there's a action occurring. There's a flexion occurring. So the action at the elbow is going to be the flexion occurring. Muscle innervation is really where we're going to spend a lot of time today, because essentially what innervation does is it controls the recruitment patterns and the total recruitment of the muscle. If we do not have muscle innervation, we cannot get these muscle actions. Our brain and the electrical signals are actually responsible for translating into muscle contractions. So it is that signal that is sent from the brain down the nerves that creates the muscle contraction. Super important here is that muscles are innervated by more than one nerve, or they can be innervated by multiple nerves. I'm sorry that I keep tripping over my words. I've had way too much caffeine today. And in particular, a singular nerve may innervate more than one muscle or portions of a muscle. Tendons are going to be connective tissue that are often cord-like in appearance, and they are going to connect muscles to bones, right? So patellar tendon is, you kind of have the quadriceps that come into the patellar tendon, and the patellar tendon inserts on the tibia. That's a perfect example of a tendon, right? It's a fibrous connective tissue. Multiple muscles can share common tendons, so they can actually come into a singular tendon. Quadriceps is another great example here. And you can also have a muscle that has multiple tendons attaching to multiple points on one or multiple bones. Does that make sense? So tendons are, it does not just have to be one tendon per one muscle or per one bone. You can have multiple muscles coming into one tendon. You can also have multiple tendons coming out of one muscle and going to multiple bones. Aponeurosis, this is a tendinous expansion of dense fibrous connective tissue that looks like a sheet. One great example is the lumbar aponeurosis. So you can imagine someone's back. This is their spine right along here. Glutes on either side, and it's the point where the lats are kind of coming into the spine and the glutes are kind of coming into the spine. You also have aponeurosis on the top of your head and your skeletal muscles, or skeletal cranial muscles. I'm an idiot. I apologize. And then there's also aponeurosis on your abdomen as well. Fascia are going to be the sheet that essentially envelops the muscle tissue itself. So it will keep separate muscles out of each other's way by wrapping inside of the sheet, almost like a kind of like keeping stuff separate with Ziploc bags. Similar concept, or putting two Slim Jims next to each other when they're individually wrapped, or you know that crunchy layer around the outside of a Slim Jim. Think about that as fascia. The origin of a muscle is going to be the proximal attachment site. So that means closer to the middle, or closer to the body, if that makes sense. So the insertion is going to be structurally the most distal attachment part. So if we have an attachment of the bicep above the humerus, and then we have an attachment of the bicep below the elbow joint, that means that above at the humerus, that's going to be the origin because it's more proximal. Down past the elbow is going to be more distal, so that's going to be the insertion point. A contraction is any time that tension is developed in a muscle as a result of a stimulus. So you can have two different types of contractions. Well, you can actually have more than two. You can have several, but two primary actions and muscle contractions that we're going to talk about are going to be concentric, which means shortening, which is this one right here. And there's going to be an eccentric, which is a lengthening muscle action, which is over on the right-hand side here. So there's several different types of muscle contractions, right? There's concentric, eccentric. You can also have isometric contractions as well. The goal of muscle contractions is to initiate or accelerate movement, slow down or decelerate movement, or prevent movement of a body segment by external forces. So everything about muscle contraction has to do with movement or the lack thereof of movement, right? Isometric contractions are when the amount of tension developed is equal to the force that's being applied. So it means that the active tension is developed, but the muscle does not change length, or the joint angles do not change. So as you can see over here, you've actually got a force being applied, but there's no net movement. We're actually holding this joint angle at one position. When we apply a pulley, we can actually reverse the directionality of the pull, and so we're weighting the triceps, if that makes sense. And here, again, you have no net movement. So it's an isometric contraction because there's no net change in joint angle. Really, this is an algorithm for developing and deciding which kind of way you're going with muscle contraction. So you have two splits. You have an isometric or you have an isotonic. An isometric muscle action or contraction is going to prevent motion. An isotonic is going to be a dynamic movement, so there's actually going to be a change in joint angle. You have two primary types, concentric and eccentric. One's going to cause motion, right? Causing motion. And then the eccentric would be controlling the motion, controlling the skid, minimizing the acceleration at which it's occurring. Isotonic contractions are any time that the muscle is developing active tension to cause or control joint movement. That makes sense because that's what we just went over, right? If it's isotonic, then it's concentric or eccentric, meaning you're either moving the weight or you're controlling the weight. You're moving the resistance or you're controlling the resistance, whereas isometric, it's a net static still. Just because a joint is moving does not necessarily mean that there has to be muscle contraction occurring. I know that seems like it's going to fly in the face of what I just told you, but I want you to think about gravity here. And what I want you to do is I want you to stand up and I want you to put and hold your arm at 90 degrees and just allow your arm to fall down. Were you actively contracting your triceps or your biceps to let that happen? Do it again. Stand up, hold your arm at 90 degrees, or hold your elbow at 90 degrees. Put your arm on your tricep or put your other hand on your tricep and then let that muscle fall. Did you feel active tension develop? Did you feel that muscle work? No, you probably didn't. And it is possible to have a change in joint angle without any muscle contraction whatsoever. Largely, it's going to be due to other external forces. So you can have the external environment manipulate your joints and not have active muscle contraction going on. Great example is gravity. The next couple of slides are really going to be highlighting more and more and more how you go through concentric contractions and eccentric contractions and trying to show what's occurring as resistance is going through. So on this first one, you can see that you're actually lifting and raising the 10 kilogram weight and shortening the distance this way, right? You're shortening the joint angle. So that means that you're going to have an active contraction and shortening contraction of the biceps, which means that you're going to be having a concentric contraction. If we flip this around and you see that there is a active movement of length or extending this joint angle, increasing this joint angle, it means that the triceps brachii is actually going to be contracting in a concentric manner. If you look over here, how are these things going to be changing? You have an external load applied and you're resisting the movement down because there's an external load. That means that you have an eccentric contraction or a lengthening contraction, a controlling descent contraction of the biceps brachii. In this final image, you can see that there is a net movement this way of closing the joint angle and trying to slow the rate at which this moves, this weight moves. And thus you have an eccentric contraction or a lightening contraction or a controlling contraction of the triceps brachii. These next couple slides are diving deeper into what that last page was going. Essentially, it comes down to these kind of major words right here, whether or not you're allowing a resistance to occur or you're overcoming a resistance to manipulate the joint angle. Right? Same thing. How are we going to be controlling the resistance? Are we controlling or are we manipulating and overcoming the resistance? I want you guys to pay really close attention to this diagram right here because it's going to help you decide what type of muscle action is occurring, what type of contraction is occurring at each joint as we're going through a movement analysis.